and gentlemen, thank you so much for being here with us this morning. If you would go ahead and find your seats, we're going to go ahead and get started. Great, thank you all so much. If you would, please join me in welcoming the governor of our great state, Governor Earl Tomblin.
Thank you, and good morning, everyone. Okay. It's indeed my pleasure to welcome you today to the Governor's Substance Abuse Summit. And I know that several of you have traveled from all around the state and from some of our neighboring states to be here to join us for this discussion today. I want to thank you for making the trip to be here and for being part of this milestone event. I'd like to recognize members of our congressional delegation. I understood that Senator Capito, as she made it, was supposed to be here today, but yeah, hopefully she'll get here a little bit later, along with other members of our congressional delegation. Our state legislators, we're very pleased to have you here today. Our counties, city, and school officials from all across the Eastern Panhandle, appreciate you being here, and so many familiar faces from the surrounding communities. It's great to see so many people who have come together to fight back against this plague on our society. Today's Substance Abuse Summit is another step forward to help shine a light on this epidemic and to bring together a panel of speakers to share their experiences in the fight against substance abuse, share their struggles, recognize their accomplishments, and identify ways that we, as a state and as a community, can continue our efforts to create a brighter future for our state and for our residents. Through our collective efforts, we have come a long way, but there's still a lot more work to be done. And today's summit is a comprehensive review of the changes that we have made, the programs we have started, and our next steps to combat this problem. I hope you find each of these presentations very helpful. Substance abuse knows no boundaries, and this epidemic is ruining the lives of far too many of our family members, our friends, and our neighbors. An addiction to alcohol, prescription pain meds, or illegal street drugs can affect the richest of the rich and the poorest of the poor. And its aftermath can be seen in city streets and all around our countryside. Through the years, substance abuse has become one of the largest issues we face here in the Mountain State, affecting our homes, our schools, and our communities, and it must be stopped. Whether we have personally experienced a family member battle an addiction or watched as a friend or a neighbor struggled on the path toward recovery, all of us have been touched by this heartbreaking epidemic in one way or another. Since becoming your governor, I have made fighting back against substance abuse a top priority of my administration. In 2001, I took the first step to address this problem and establish the Governor's Advisory Council on Substance Abuse, with 6 regional substance abuse task forces. I charged members with working together to find better, more localized ways to combat substance abuse in our communities. And since establishing this working group, more than 4,000 West Virginians have attended 102 public task force meetings to share valuable input and make specific recommendations on how we can best address the unique substance abuse battles in all corners of our state. Any questions about the significance of this problem in our state and across our nation should have been answered just 2 weeks ago when President Obama and Health and Human Services Secretary and native West Virginian Sylvia Matthews Burwell traveled to Charleston to spotlight the seriousness of this issue and highlight some of the steps we have taken to address it. As they noted, this is not a rural or an urban issue, a Democratic or Republican issue, or a black or white issue. Substance abuse affects every one of us in some way, and that's why I'm proud to bring together this impressive group today to talk about how we can stop substance abuse from ruining the lives of so many of our people. To kick off today's presentation and to tell you a little more about the work of GASA, our Governor's Advisory Council on Substance Abuse, I'd like to introduce and welcome Commissioner Vicki Jones. of the West Virginia Bureau of Behavioral Health and Health Facilities. Now, Vicki has worked with me from the beginning. She's an active member of GASA and is here today to share more specific information on this working group and how the regional task force meetings have helped to develop regional and statewide recommendations for substance abuse prevention, early intervention, and treatment and recovery services needed in West Virginia. So please join me in welcoming Commissioner Jones. Vicki.
Good morning, everyone, and thank you, Governor Tomblin, not only for being our leader, but being a champion for substance abuse and all the initiatives that we have embarked upon over the past several years. You've truly made a difference, and we're going to talk about some of those today. The Governor's Advisory Council on Substance Abuse, as Governor Tomblin stated, it is the governing body that's designated to work collaboratively, and I think that's a very important word, to work collaboratively, to provide guidance regarding the implementation of not only our statewide strategic action plan for substance abuse, but to make recommendations for service provision, education, policy, and legislation concerning substance abuse initiatives. And he asked us to do so, and this was probably one of the most important things that he asked us to do. And that was to, when you're looking at these recommendations, only look at the recommendations after you take into consideration what the communities are telling us. Because, as you very well know, and this is probably one of the areas that we can say this most about, no two regions of the state are the same. What's going on in one region of the state isn't going on in another region of the state. The solutions for this region of the state is not necessarily the solutions for another region of the state. And so we have to act differently. We have to be flexible. And we have to look at initiatives from the grassroots level up, and we have to develop these public-private partnerships that not only enable us to develop the programs and services that are needed in your particular area, but we have to be able to work together to sustain those programs. The Governor's Advisory Council on Substance Abuse meets quarterly on an annual basis and has done so since 2011. We are looking at resources, what's available, where are the gaps in service provision, and we're looking at the strategic action plan, making sure that we can update that plan on a regular basis. Workforce is essential part of that plan, and it's something that we are struggling with in this area and all over the state in terms of having a drug-free workforce. Governor Tomblin has developed initiatives to address that as well. We are learning about what recommendations are coming from many of you that actually attend the regional task forces, and so I want to thank you for doing so, because it's making a difference in what we do. We all recognize there's much work to be done. We haven't solved this problem. We're not close to solving this problem, but we're making a difference, and there's hope. And that is significant. It's significant compared to where we were 3 years ago, 5 years ago. And it's going to make a difference of where we are tomorrow, not only for each of you, but for our children. They are our priority. We recognize these solutions are not going to come easy. Probably never will, but because this is a disease and it's a deadly disease. I would like to take a few moments to share with you some of the successes of our collaborative efforts, because I think oftentimes we weigh ourselves down with the problem, and we don't really take a moment to step back and say, you know, we've had some successes. And I want to share those with you because they indicate that that is a hope for the future. And with hope brings renewed enthusiasm. I know it does probably in our own daily lives with our families, with businesses. I know it does in my bureau. And we are dedicated to working collaboratively with Governor Tomblin, Secretary Bowling, and so many of our legislators that are here today, and really that aren't here today, that couldn't join us, but that are dedicated as well. We're working to ensure that each of us as individuals can develop a future for our children and our loved ones. Over the past several years, Governor Tomblin and the legislature has worked to develop an infrastructure. And as much as we struggle, and we're struggling in this area, and I recognize we're struggling in this area, we do have initiatives that we have brought to this area. We have invested all over the state of West Virginia in making an infrastructure that we never had before. There are areas that never had recovery homes that do now. We're working hard to provide treatment services for this area and recovery as well, because we want you to be able to have not only the treatment that is needed, but also the recovery in order to sustain that treatment. Some of the things, the accomplishments that we have done have been some group homes, community engagement specialists, and for those of you that may not be aware of what these are, they're kind of like care coordinators that work individually with individuals to ensure that they stay in the communities and that are not committed or have to be moved to a more restrictive environment. Day treatment programs, supported housing slots. How often do you hear that someone does not have a place to live? We have expanded our outpatient services. Crisis stabilization and detox services are something that's critical, not only for this area, but for all over the state. And that's something we're working hard to get in this area as well. Intensive outpatient services, recovery homes and coaches, and many other initiatives such as screening and brief intervention and referral to treatment. It's SBIRT, and it's the integration of primary care and behavioral health care. I see some individuals nodding, and that really is something positive, because that's telling me that individuals know about these programs and that they are available for you. In coordination with increased and expanded community-based behavioral health services, there's a lot of community projects that the regional task forces have worked on individually to make sure that some of the things that are within their reach that can be accomplished by themselves, that is something that is already being accomplished. I see take-back boxes. I walked into this area today, and I saw a drug take-back box in the lobby. It's something that I have to commend the law enforcement for actually working collaboratively with us in order to develop those types of programs. We've also seen some policy recommendations that and some administrative and legislative action that has taken place, some of which are listed here on Governor Tomblin's substance abuse epidemic and the fight and the strategies that have been incorporated. The adoption of the prescription drug monitoring database and reporting requirements that is working collaboratively, not only here in West Virginia, but quite frankly with other states, because we understand that crossing the lines is a major issue, in particular in certain areas of the state, this being one of them. Stricter regulation of the opioid treatment centers and pain clinics. There's already been 11 pain clinics that have closed. Now, what does that mean? That doesn't mean that all pain clinics are bad. What that means is that when there's a problem, we are addressing that problem. Expanded distribution of naloxone and other opioid antagonists for the heroin epidemic and other issues that we're facing in order to save lives. And this is for family members and addicts alone. We're working collaboratively with our partners as strategic planning with public and private sector systems are a must. I was just talking with someone before this meeting today, talking about that public-private partnership and what that means, not only in developing programs, but sustaining those programs. We've done a number of these things since fiscal year 12, but that doesn't mean there were not initiatives going on before that. It just means that the focus has been under Governor Tomblin's leadership. We're building on the efforts that we've already made, and we're creating new efforts. I talked with a few people this morning, about how we in the Bureau for Behavioral Health and Health Facilities can come and help you from DHHR's perspective. For the first time ever, Governor Tomblin has approved a behavioral health call line, and I have to tell you, it's amazing. We are moving forward with developing supports, real-time live supports for individuals when they call. And we've done some amazing things from the department perspective as well. What I would like to say in wrapping up is that we have done some things. We have some more things that we have to do. We want to be able to work with you to achieve those positive results and those positive outcomes that we are so desperately needing in this area and around the state. And we need you to help us find what those solutions are. So I want to thank you for being here today, for all that you do when you're not here, and being dedicated to the efforts that we are trying to achieve from the highest level and the grassroots level up. So thank you very much.
Well, thank you very much, Vicki, for sharing that information on how GASA, get it right here in a minute, continues to work in local communities to tackle substance abuse in the Mountain State. At this time, I'd like to introduce and welcome my good friend, Doug Copenhaver, to the podium to say a few words. Doug currently serves, as you all in this room would know, as president of the Berkeley County Council, and is here to tell you a little bit more about how our efforts have assisted in the local fight here in Berkeley County against substance abuse. Doug and I have had many discussions over the years, and he has some personal stories to share with you, so it's indeed my privilege to introduce Doug.
Governor Tomblin, it's always our pleasure to have you in Berkeley County, and our wonderful governor of the state of West Virginia, Vicki. Thank you for your time and your kind words and your direction that we're going in. The governor has asked me to talk to you all about our personal experience in the Copenhaver family, and I want to start off with that, and then I would like to go into some things of the county council and with the help of the governor's staff where we're heading. But I asked the IT director, Gary Wine, to assist me. We brought in some pictures of our wonderful son, and I'm the only one here standing in front of you today, but he's going to tap me on my shoulder when I lose my composure. Douglas was our son, born in 1989, and this is a picture of him at a wedding reception trying to play around with his cousin and wanted to dress up a little bit. And the whole point of talking about this today is he was the perfect child. He was the one that woke up in the mornings and worried about, is he going to be able to pass with 100 on his spelling test? He was very, very kind, loving, loved children. And towards the end of his life, I kind of worried about the direction he was going in and what people would think about him. But I think God answered that when there was 800 and some people at his funeral service, and told me and his mother and his sister what a wonderful young man he was. The next picture, Gary, if you would, is a hunting trip in this great state in Pocahontas County in a place called Holsterman, where we was bear hunting, and his boots were too big for him this day, and so I stuffed a little bit of toilet paper down in him and asked him if he wanted to turn around. He said, "No, Dad." He says, "I want to keep going." And we was lucky enough to see 2 bears shortly after that. And just a wonderful, wonderful young man. Very smart, highly intelligent. And but he, as he got older, this is, if we go back, this is his graduation picture. Again, you can look at his eyes and see how innocent he is. Johnny Greenberg, you've seen him in school. And he started getting into trouble about that time. His first experience was alcohol at a young age. And his mother and I decided to send him in a place down in Winchester for alcohol treatment. And a couple months before he passed, he told me that that's where he got his knowledge on opiates. So when we get into the recovery centers, these people that are going to be doing the treatment side and doing the counseling side, I only beg you to be there for the right reasons. Be passionate about trying to get these people clean and off the streets and not allowing them to get further educated. The next photo is him and his sister, thank God. They went and got this photo taken over Hagerstown Mall because a friend of mine, before he passed, gave us a blank check and signed it to a photographer to get a family photo, which, sad to say, we never got done. But Douglas and Ashley got together and said, let's go get our own. So that Douglas, he was, I'm 6'4", 205 pounds, and Douglas is 6'1", 155 pounds. But he found a pair of jeans, of my jeans, and put them on, my shoes, and away him and his sister went to Hagerstown and got a bunch of photos, and it was a good time for him. I believe that was the last one. No, there's one more. The next one is him at 22 years old. He was on the Macy's project, running a grader in this picture. And that's the year he passed. So not only did he get treatment as an underage alcohol, because I want to make sure and reinforce what Governor Tomblin said, it started with alcohol, as many of us do. And then it moved into marijuana. Then it moved into opiates. And thank God, and I hope I'm correct in saying that's where it stopped with him, but, you know, who really cares at this point? And his mother and I was trying to be very protective and trying to make sure he got help. And actually, these people, when they need help, they actually treat themselves. They self-medicate. If they can't get the right help, you hear it all the time. So he started self-medicating on opiates. And sad to say, our son wasn't one that died from an overdose, so he never showed up in any numbers, any stats. We know that Berkeley County right now currently is in the Baltimore-Washington HIDA area. We are tied at number one, sad to say, as having the most drug overdoses and tied to Baltimore City. That's sad. We look at ourselves as being a nice little rural area, and to be tied with the Baltimore City and drug overdoses directly. Since our son's death on August the 5th, 2011, coming back from the Berkeley County Fair, we have lost over 100 people directly, accountable directly. And I would be probably guessing, but I would say that there's probably been 400 to 500 people indirectly that don't show up. Sad to say, our son repetitively tried to self-medicate him, and I'm a pretty strong person, and I've always been in my past thought that I could conquer anything and maybe take on anything that was thrown at me, but I was wrong. God proved that on August the 5th, 2011. I can't change what happened. I can only change it for the people in this room and for the people in Berkeley County. See, the last time that Douglas self-medicated himself, he got pulled over by a deputy here, a wonderful deputy, because he broke the law. He was so nice to the deputy that he asked him if he could go back over and put his window up, because he's going back to jail, because the last time he spent 30 days in the weekends. And I told him, I said, son, if you don't straighten your act up, you're going to go back to jail for a much longer time. And every weekend I would remind him of that. And every time he would look at me square in the eye and said, Dad, I'm not going back to jail. I said, son, you don't have a choice. If you continue down the path you're going to go back to jail, and this time it's going to be longer. See, that was the only recovery option that I knew of. Every time you reached out, the doors were closed. So I thought I pretty much told him that you have no choice. You either change the direction you're going in, or you're going to go back to jail. Well, August the 5th, 2011, about 7 to 8 o'clock in the evening, Sheriff, you probably know better than I do, he proved his dad wrong. Because when he got back in that vehicle to roll the windows up that the deputy was so kind to allow him to do, he took off. He already knew what he was going to do. I know for a fact, and I don't care to speak about that because there are some things my family don't know about, and I'm the only one. But he took off, and he hit a steel pole that supports stoplights at a high enough rate of speed that a four-door SUV will fit in anybody's 4x8 pickup truck. He, in my belief, he knew that he was raised properly. He knew right from wrong. And the only way he could get out of the situation he was in was to take his life. I don't want that to happen to anybody else. I didn't want it to happen to the 100 people that we've lost since then. I am proud to say that this county council, Berkeley County, with the help of the governor, is trying to move forward, or we are moving forward. We hope to have a building to be able to do a recovery center for all citizens of Berkeley County, a community recovery center. And I hope it goes well for us. See, we're taking action. We know that 70 to 80% of the people that's incarcerated are there because of some type of substance abuse. That's $3 million for Berkeley County citizens to pay in regional jail costs. All we need to do is redirect that into treatment. And we all know, and I know the circuit judges know, we can't continue to incarcerate when we should be treating. And I'm not saying be soft on the drug dealers. I'll stand behind any cop in this room or anywhere in the state, in this nation. If you're dealing, you need to go away. If you are committing crimes, you need to go away. Our son never committed a crime, never stole a penny off of us. So I ask you to move forward in the direction that the governor has paved to help the citizens of Berkeley County, which I can assure you, if you don't know of anybody that has a drug addiction or an alcohol addiction in your room, you will still benefit by great numbers. Just to let you know, we can't get everything done here. I was given a 3 to 5 minute time limit. I know I'm well past that. So the county council invites anybody that has time to stay after this meeting. We'll go over to the council chambers and pick up where we leave off. We don't want anybody to leave without knowing what's going on or knowing or getting to know one another to take this to the next step. Governor, thank you.
Thanks, Doug. That's tough. But anyhow, just want to get my composure here a little bit, but I just want to say thank you for all that you and the county council is doing. I think you're exactly right. We cannot continue to incarcerate. We've got to give people the help they need. So anyhow, thanks for all that you're doing. Your work is very inspiring. Our fight against substance abuse must be fought from a number of angles, and that includes a mix of community programs, services, and efforts at the local level, as well as statewide reforms to help those struggling gain access to the resources they need, which is what Doug is talking about. During my time as governor, I have introduced a number of bills to increase and enhance these efforts, and I'm grateful for the overwhelming bipartisan support by the legislature. Delegate Stephen Skinner is here today to share more about these pieces of legislation that, together with other reforms, have helped us to fight this epidemic in our communities. Steve.
Let me first thank Doug for his courage, because many folks would not have the ability to come out and share their story and move forward in a positive way. And it's only through sharing those stories and taking action that we are going to move forward. Thank you for your courage. Thank you, Governor, not just for having the summit, but for having it here. I know I spoke to a few people in the community who are deeply involved in treating our epidemic when it was announced that the president was coming to Charleston. And they said, well, why not here? You know, we need to emphasize it here. And this is a great counterbalance to that, and I thank you for that. I've had a lot of opportunities serving in the legislature to be able to talk to my colleagues across the state. And it is absolutely true, as the commissioner suggested, that our problems are different in the communities across the state. And dealing with the issues related to drugs and the epidemic and law enforcement is one of the areas we find in the state where we have a bipartisan approach. I'm going to talk about a few of the things that are up here on the board, but I think every piece of legislation that we have under Governor Tomblin received unanimous, not unanimous, but nearly unanimous support in a bipartisan way. And even as the legislature has changed hands, we found the same kind of focus and willingness to work with the governor to accomplish these goals. Back in 2012, the governor led the way with Senate Bill 437, and that was to deal with reform in how we looked at some of the specific problems that were happening in the state, particularly with pill mills and particularly with folks getting access to the drugs that they could make other drugs with, including meth. It put methamphetamines and track prescriptions into the MPLEX system. And as we've already heard, 11 pill mills across the state of West Virginia have been shut down. And we've made this state a lot less welcoming for those who would abuse the process, while at the same time making sure that those who need the right treatment can get it. In 2012, the House Bill 4351 really looked into coal mine safety, and it started looking into drug testing for those who go down into the mines and work on equipment that's incredibly dangerous. Since that time, we've had 837 mining certificates revoked, making mines, which are very dangerous to begin with, much safer. In 2013, the governor asked the legislature to support his drug driving bill. And drugged driving, as I know law enforcement knows, needs a different set of tools than regular drunk driving. If a driver is pulled over, a simple blow test may not reveal what is in their system, even though that they are legally impaired. This bill gave law enforcement the same kind of tools that they already had for drunk driving, but for drug driving. In 2013, the legislature agreed with the landmark legislation from the governor and passed justice reinvestment. This is a program that we're only now starting to really see come into effect across the state. How do we take the funds that we're using to incarcerate people, as you were just talking about, how do we take those funds at the end and move them to the beginning? How do we use data and evidence to make sure that the people who are most likely to reoffend get a different kind of treatment? How do we make sure that people who need substance abuse help get that in their communities rather than sending them off to a place where they're not going to get any treatment? The added benefit, hopefully, is that we're going to incarcerate less people in prisons and deal with local problems in a local way. One of the parts of that bill I was happy to work on in the Judiciary Committee was the adult drug courts, which we are now starting to see across the state have some enormous success. to make sure that we divert when appropriate, but put into the regular criminal justice system when needed. This past year, we passed the Opioid Antagonist Act. And for those of you who don't know what Narcan is, this will save a life of someone who is overdosed. We looked to some of the states across the country who'd already given greater access to naloxone, like Massachusetts, and said what we're seeing by giving law enforcement, by giving family members access to Narcan, is the ability to, on the spot, reverse an overdose. We're going to see that and the lives saved from that over the next few years. But that is bipartisan, yet progressive. We are looking at a new way of tackling the problem without simply locking people up. The criminals need to be locked up, to be sure. But the people who need to be treated should be treated in our communities. And I want to thank the governor for his leadership, and I look forward to another legislative session with your leadership.
Okay. Thank you very much, Delegate, for all your help and support as we have changed the way we're going about treating those with substance abuse problems. And not only Delegate Skinner, but other members of the House and Senate who are with us today. I just want to say thank you for your help. You know, while these laws provide new ways to fight against substance abuse, our community partners carry out this legislation, enforce these regulations, and support these programs every day in their hometowns. At this time, I'd like to welcome and introduce Dr. Sylvia Dekas. Dr. Dekas is a pharmacy practice resident at the VA Medical Center, Veterans Affairs Medical Center, and in her line of work has seen the daily effects of prescription drug abuse. Dr. Dekas joins us today to speak about the use of Implex and how our prescription monitoring efforts have helped shut down pill mills and curb this epidemic. Dr. Dekas, there you are.
All right, good morning, everyone, and thank you, Governor Tomblin, for allowing me to be here today. So the first part of my presentation today, I'm just going to discuss Implex, National Precursor Log Exchange, and then I'll go on to briefly discuss some medications that are used for opioid dependence. Okay, so with Implex, before I start, just by a show of hands, how many of you have been to the pharmacy counter before to get either your cold or allergy medication? Okay, so to the pharmacy counter. And the reason why you're going to the pharmacy counter instead of in the aisles on the shelves is because it contains a ingredient called pseudoephedrine. Pseudoephedrine is what's used to make methamphetamine. And for that reason, both pharmacy and both the law enforcement likes to monitor who's getting it and how much they're getting. So Implex, National Precursor Log Exchange, it's a service that allows law enforcement agencies and also pharmacies to track the sales of those medications. So the process typically goes like this. You need your government ID in order to purchase it. So you present either your state ID or your license or your passport. And then once that's scanned into the system, it sends a message to Implex saying how much you're getting and who's getting it. So federally mandated, there are maximums to how much pseudoephedrine you can get per day or per month. So the system tracks that and stops customers who are getting too much or who have reached that maximum. So with this log, only law enforcement can look at it. Only law enforcement has access to look at it. And it's considered free for a state government. So with Implex, just to give you a reference, it's about 15 tablets of 24-hour Claritin D per day per purchaser. And if you want to translate that into per month, it's going to be about 37 Claritin D tablets in 30 days. So this service, Implex, has been used since 2011, And since then, about 4.7 million boxes have been blocked. So, also with that, there has been a significant increase in meth labs that have been seized since the implementation of MPLEX. So with this service, officers can self-register using agency information. And also, if they would like, they can receive email alerts to specific people trying to purchase more pseudoephedrine. Okay, so that is MPLEX. So next, I'm just going to discuss a few medications that are used to treat opioid dependence. First is methadone. It's actually the oldest one that I'll be discussing, and it's been used for over 30 years now. It's indicated for both withdrawal and maintenance of opioid dependence. Some advantages include it being dispensed in a methadone clinic. Now, with methadone clinics, the person has to visit the clinic every day in order to get their medication. It's not done through a pharmacy or anything like that. It's done through a clinic. Cost is typically less, and it can be income-based depending on the person seeking treatment. If they can't afford it for whatever reason, then they would be offered the same service at a lower price. Also, there's group counseling that's often provided for persons seeking treatment. And with methadone, one of the good things with methadone is that there is no ceiling effect. So patients who develop tolerance, they can continue to be treated at higher doses. And that's not always the case with these medications, as I'll discuss in a minute. So some disadvantages can be the same as one of the advantages that I mentioned, meaning a patient would have to visit the center every day. So if you don't live near that methadone clinic, then that can be a problem. Or if you have to go to work every day, as many of us do, that could also be a problem. So that's something to take into consideration. Also, it does show up on urine testing for employment, so that can be an issue with some patients. And also, because they have to go to the clinic every day, they do have a more strict protocol, and some patients can see that as having less control over their treatment. So with methadone, it's been found to be effective in patients who have failed other interventions. So it's not necessarily the first-line treatment for a patient with opioid dependence. It's usually second or third down the line. As far as success rate has gone, there has been high relapse rates, but that's with all of these medications. It usually takes a few times in order to get a favorable treatment response. And also, it's important to note that with all of these medications, it's best to pair it not just with the medication, but also with behavioral therapy. So group or individual counseling has been shown to have the highest success rates. Okay, so next medication is going to be Suboxone. Suboxone actually has two medications in one, both buprenorphine and naloxone. So it's indicated for both withdrawal and maintenance. And advantages include it being more accessible. Now, this is one medication you can go to your pharmacy and receive. You don't have to go to a clinic. You don't have to be present every day to get it. You just get your prescription, and you're on it for however many days the doctor wrote it for. So Suboxone is actually associated with less withdrawal symptoms than methadone, and it's also considered to be safer. Methadone, there is a potential for overdose, not so much with Suboxone, so that's definitely something to take into consideration. Disadvantages include, although the withdrawal symptoms may last longer, although the withdrawal symptoms may be less than with Suboxone, they tend to last longer. And also, it is still abusable. It can be abused since buprenorphine is in itself an opioid. Another disadvantage is that it is a higher cost. Methadone has been around for over 30 years. It's pretty cheap. And whereas Suboxone is newer, it's more expensive. So as far as success rates, it's actually been proven to be more successful or lower relapse rates than with methadone. And that's possibly due to, with methadone, you have to come in every day, and patients they tend to, maybe skip a few days. So with Suboxone, it's easier to be accessed, so patients usually don't have a problem taking that. All right, the last medication I'll be discussing is actually naltrexone. So naltrexone is actually used for both alcohol dependence and opioid dependence. And it can only be used for opioid dependence, it can only be used for prevention of relapse after detox. So it's not very useful for withdrawal symptoms. It can only be used after 7 to 10 days of opioid-free, periods from a patient. So because of that, there is a risk of acute opioid withdrawal. So that's definitely something to take into consideration with naltrexone. And the way it works is it blocks the high of opioids, but it doesn't decrease cravings. So because of that, there has been some issues with compliance with naltrexone, and that's something to consider. And an advantage, though, is that it's non-addictive. The other two medications I discussed, they are opioids, so they do have addictive properties, but naltrexone, it's considered an opioid blocker, so there are no addictive properties to this medication. And another advantage with naltrexone is that it is available as Vivitrol is the brand name, and that one is a once-monthly injection. So because it's only once monthly, there's usually not an issue with that formulation of the medication. And as I stated earlier, the best treatment for opioid dependence is a combination of medications and behavioral therapy. So while these medications are important and they have seen benefit in patient populations, it's always best to pair it with behavior therapy, so group or individual counseling. All right. Thank you so much for your time.
Well, thank you very much, Dr. Degas, and it's good to know that there are things that can help our people if they want help in West Virginia. So, but I do want to thank you and the work of your fellow pharmacists. It's been mentioned 2 or 3 times that we have been able to shut down 11 pill mills across the state for violating safe prescription procedures to ensure that West Virginians with true chronic pain have access to the treatment they need, but not at the expense of irresponsible prescription practices. I've also led the charge against prescription drug companies that oversupply prescriptions and pain medications to our residents without proper prescription orders. And I remain committed to holding these companies accountable for their illegal and irresponsible practices. To continue our comprehensive substance abuse efforts, I've signed an executive order in 2012 requiring Workforce West Virginia to mandate drug testing before providing services to those seeking employment. What had happened before, we were able, through our workforce training program, to send people, get them the training they needed to be ready for jobs. When they went out and had to take a drug test, they could not qualify. So basically, we've changed the way we're doing things. We're testing up front. If you're clean, we'll educate you and give you the kind of tools you need to become employable. If not, we'll offer you the help you need to get clean if that's what you need to do. So anyhow, we've worked very hard over the years to make sure that we got the kind of workforce we need in West Virginia. Also, we've worked very hard to prepare our students, our future workforce, for the jobs that we're creating for them. Our state's simulated workforce programs are designed to teach our students the importance of being drug-free. At this time, I'd like to welcome Rodney Strauderman from James Rumsey Technical Institute, the newest simulated workforce program in West Virginia, along with 2 of his students, Sierra Covey and Ryan Hill. Now, Rodney serves as the work-based learning coordinator and helps to train students for the jobs of today and tomorrow, while also preparing them to be successful in all facets of their lives. So, Rodney, back over here, and his 2 students. Welcome, sir.
I want to thank you all for allowing James Rumsey to be part of this. Thank you, Governor Tomblin. Before I turn it over to the students, because they're working in the classrooms and probably know what we do best, I just want to say that the nature of what we do at James Rumsey, because it is a technical school, and we're working with 3,000-pound vehicles with students under them, working with hydraulics, pneumatics, we're working with patients and nursing homes. It's critical that our students are, at the best of their game. A cloudy mind would not work well underneath a huge vehicle while you're working on it. So at Rumsey, as Governor stated, we are part of the simulated workplace. We are one of the model and pilot schools, and with that, we have started drug testing 2 years ago. First year we drug tested, we randomly drug tested 13 students, 3 tested dirty. They offered help to those students through East Ridge, and at the end of 1 month, all 3 were clean. So that was definitely a positive step. Last year we tested 93 students, and we had 4 tested dirty. Of those 4, 3 within the month tested clean, and with help through East Ridge, the 4th student tested clean on the 3rd attempt and still currently works with East Ridge to stay that way. So with that, I want to turn it over to the students. Thank you all again.
Good morning, y'all. I'm Brian Hill. I'm up at James Rumsey Technical Institute in the automotive technology class, and we do get random drug tested. I did last year, and I came out clean. And I mean, it is a good program, and with the drug testing, we always kind of keep each other safe. Whether it be we're underneath the vehicle, like Mr. Strawderman said, or working with hydraulics, or turning a brake rotor or brake drum. There's a lot of stuff that can go wrong with a cloudy mind. And we always make sure that we're safe, and we use all our practices, and we have a safety coordinator with us at all times. And whether that be our instructor or the person we elected to be the safety coordinator, we always work hard and we work safe. That's the best thing we can do.
Hi, you guys. My name's Sierra Covey. I go to James Rumsey Technical Institute, and I am in the Therapeutic Services Program and Fire and EMS. With our programs, we are very strived to be the best workers we can be. So in my nursing program, we are the biggest program that is set up in simulated workplace. Simulated workplace is basically setting us up for a job. As you can see, I'm not very dressed for the occasion because I just came from my clinical setting at a nursing home. In our program, we are randomly drug tested. We have different committees, as I should call it. We have different committees to help us set up and recognize the different problems that could happen in our school and in our program. So our biggest committee would be safety. Our safety committee regulates the drug testing. They are one people to step up to say what is going on in our program and what we can do to fix it. We also try to improve the school by making posters and advertising different ways to get help or stay safe. That's all I have.
Thank you. Thank you very much.
Well, it's pretty inspiring to hear young individuals like this and knowing they're preparing for a career, but realizes the importance of being clean and being able to handle a job once they get that kind of training. Now I'd like to turn today's presentation over to our local law enforcement officials who continue to be a very strong supporter of the work that we're doing to curb substance abuse and put people on the right track toward becoming productive members of our communities and our workforce. At this time, did I get out of place here? Well, at this time, anyhow, I'd like to welcome and introduce our sheriff, a longtime friend of Berkeley County, Kenny LeMaster. Sheriff LeMaster is going to share how he and his team are working to implement life-saving legislation passed in recent years and fight substance abuse from the perspective of first responder. Now, as you can see, Sheriff LeMaster just had knee surgery last week and made it a priority to literally get back on his feet so he could be here with us today. So please join me in welcoming the sheriff to the podium. Sheriff.
I'd like to welcome everybody to the Berkeley County Sheriff's Department. And it's kind of ironic, but also a good thing that not only do we use this department to enforce laws and arrest people, but to have community meetings and summits like this one. Recently, this past summer, a real quick cap on what took place, and a lot of you have been reading, is our Drug and Violent Crime Task Force was able to do an arrest of 41 people. That's phenomenal because with those 41 arrests, no one was hurt. Not the officers, not the people. It's easy to read in the newspaper about this one pled guilty and this one didn't plead guilty and we're having a trial for that one. But in essence, there was a lot of work, pre-work done for this case, and that's not seen. And, the investigators, you don't see them in the paper very much. They're the guys who work undercover. And Berkeley County Sheriff's Office is a parent agency, as well as the Jefferson County Sheriff's Office, as well as the Martinsburg City Police and the West Virginia State Police, and we're subsidized through the FBI. So, those guys go out and do the undercover work. So you don't see them, and when you do see them, you say, they're not really cops. But anyway, that's just one of our assets that we have. And, it's ironic because in the same room we did the training for that same involvement. We did the deputization in here, and we did the briefing before the raid. And then, of course, when the raid was carried out, everyone was arrested, was brought into this facility and so-called booked or debriefed and filled in and then taken to the federal courthouse. But this is a multi-use facility, and it's come in handy for those things. With that task force has come the ability to get recognition by HIDA. And of course, it's not a very nice recognition, but it's still a needed recognition to be able to have the resources and assets provided by the federal government. And this comes with a lot of discussion, meeting with Governor Tomblin early on, in my term as sheriff, as well as Doug Copenhaver, and a lot of our legislators and our state representatives that, they've been able to recognize the fact that we do have a problem. And, a lot of these have come about. And when you look around the room, you're represented by everybody. It affects everybody. With the work of this task force and the recognition by HIDA, we've been able to recognize the prosecutor's office, which is understaffed and they need support. And I think they've gotten some funding for another role in the combat that we have with this epidemic. We, I think, recently are getting some resources through the county council for some funding from HIDA through that. So, yeah, it's bad to be recognized, but it's good that we're getting the resources that we need to combat this. I've heard a couple of comments about some of the things that's coming on that affects the law enforcement, and one of them is about the drug driving, and it's quickly becoming a problem where our driving under influence is falling, and there's been a decline of about 30% from 2007 to 2014 in the drunk driving. But we've had an increase of 16.3% from 2007 to 2014 in the drug driving, which has showing a rise during that period. So one, we're combating very well and is going down, but the other is still going to be a battle and it's continuing to expand. With that being said, with the new law that we have to do additional training, and talking with my officers and the trainers and so forth. Right now, law enforcement's got about a 3-week training period of one individual having to have 3 weeks of training to be a so-called expert in determining, driving under the influence of drugs. above and beyond what we have as far as under the influence. So, that's going to take a chunk out of law enforcement as well as any budget to do. Right now, I think we only have one in the Martinsburg Police Department, maybe two in Jefferson County that have been qualified in this training with hopes of expanding. But, it's just one of the problems that we face with anything new, anything that we're combating different, is the training and getting the experience to be able to combat it, and combat it to a point that we can get some type of advantage as far as convictions on these individuals. The other thing that has come up is the Narcan, naloxone, which is a good resource, a good advantage, because anymore you listen to the ambulance calls and they're always calling for law enforcement because it's an overdose. And with those overdoses, sometimes law enforcement does reach the scene before EMS. It's going to be, again, another training fulfillment, because a lot of officers aren't going to be that comfortable doing something out of what they're, trained to do and do on a regular basis. So getting them to be able to use this drug, life-saving drug, is going to be a little bit difficult to get everyone, number one, where they recognize that it is an overdose, and then number two, to administer the drug, the Narcan. So, that's another bit of training, and every time you say training, it's a necessary evil. You got to have it to do a good job, but at the same time, it cuts our already strung out resources a little bit further along. So, all these things are good, and it's a good objective, but, at the same time, don't forget that our budgets are thin too, and has to be increased to meet this load, this workload, and it doesn't seem to be going away or decreasing any. It's staying very steady. I'd love to see the drug task force expand and get a little bit larger for the workload that they're handling. And again, the more you have, the more that you can come up with. And I think we're just kind of scratching the surface, because it's in all parts of our lives, whether it affects you with being burglarized or something stolen out of your car, which affects your insurance and which affects everybody's insurance, or whether it's a family member that needs help to get rid of this monkey on their back. So thank you, Governor, and everyone else that's working to get an end to this means.
Thank you, Sheriff, for being here. I'm proud of him. He set his crutch down over there and could walk right over here. So, but yeah, I want to thank the Sheriff and all of our police officials for what they do to fight substance abuse in Berkeley County and our state. While our state's law enforcement officers continue their efforts to get drugs off our street, we're also working to rehabilitate rather than just incarcerate those who may have made a mistake and chosen the wrong path. In 2013, we took a big step toward reaching this goal, and through it's been mentioned before, our landmark Justice Reinvestment Act was passed. And this legislation has helped us provide those struggling with substance abuse in our state's prison and regional jail system with the treatment they need to overcome their addiction. It's also increased access to drug courts statewide and provided nearly $10 million toward community-based treatment and recovery services, nearly doubling programming already available and expanding access where services were either limited or non-existent before. The Justice Reinvestment Act serves a dual purpose in our fight against substance abuse. It gives offenders access to the resources they need to rebuild their lives and provides community-based treatment to those who need it to keep them on the right path. Now, we have two speakers with us today who share different perspectives on justice reinvestment and the impact it's had on the lives of West Virginians. At this time, it's my pleasure to welcome and introduce Tanya Williams and her son, William Fields. Now, William is currently in the drug court program, and by all accounts, he's making great progress. So please join me in giving them a warm welcome.
Hi, thank you for inviting me, and thank you, Shannon and Judge Greenberg and Shanna, because they have been an essential part of our lives in helping William to get drug-free. Before William started the program, he was just out on his own, very very distant. Didn't want to be around the family. I would ask him, William, are you doing drugs? And he was like, no, which I wanted to believe him, but in all honesty, in the back of my mind, I knew it was a lie, but I just didn't think that my child would be the child that would do drugs. And I thought that I've always taught William to be a leader, not a follower. You're going to make something of your life. Well, all that came to reality when William had offered a child in our neighborhood drugs, and this parent had came to my house. And right in front of my face, our neighbor said, your son offered my son drugs. And I wasn't home at the time, his stepfather was, and Will sit there and lied to his face and stated, I didn't do drugs, I'm not high. And Will was high as a kite. That's when I said to myself, I have to do something. So I started researching. I took William to therapy. He didn't like therapy. He said he didn't like the therapist because she had red hair. We got in the car. I took him back to school after therapy, dropped him off. William ran out the back door. His grades were at F's and D's. I just was losing my mind. I didn't know what to do. So I said, well, fine, I'll take you to another therapist. So it was Dr. Betty in Jefferson County. And that therapy went good. And she got me in touch with Rick, who is a Berkeley County probation officer, who then got me in touch with Shannon Travis. And that's when our family life began to change. And William then began in phase 1, but however, he got setbacks. He is the one child that was in the program that it took him 6 months to get to phase 2. All the other kids were in phase 2 in 2 to 3 months. I was like, what is going on? And Judge Greenberg kept giving him sanctions, and I was like, he's never going to get through this. We're going to get kicked out of the program. Shannon gave him different therapists. He didn't like the therapists. None of them worked. And the only reason why he didn't get to phase 2 is because of the fact that he wouldn't participate in therapy. So one day, heaven behold, Shanna Weidman came into our lives, and everything changed. William got himself together. He made it to phase 2. William started talking again, started laughing. His grades started coming back up. He was always a loner before because when I was in school, we always called him burnouts. Well, he was no longer a burnout. He he's back in regular school now, did a 360-degree turnaround. We're now having family time. He's no longer beating up his brothers. He's no longer causing family strife. He's no longer getting into alcohol. He's now on the basketball team. Doing really good. And the first time in his life, I can finally say he has a girlfriend. And now all of his friends are now drug-free. And that's a great thing. So I really wanted to give a special thanks to the drug court program, because without this program, kids could not understand the crime that they committed and how their wrongdoings can then turn around and become a right. This program is very special to me as well as William and our family, because it gives you the right tools to continue to stay drug-free, from counseling, from counseling with individual, group counseling, then with the drug court and the peers getting together. I want to thank Judge Greenberg, because Judge Greenberg is a wonderful judge. He does not play. He lets the kids know that, hey, you know, I care about you, but do you understand what you did, and do you understand that you're going to get a sanction for it? He doesn't miss anything because of the fact that he has Shannon Travers, who knows everything. She knows stuff before you even know it, before the family members even know it. And she has a memory that just will not quit. This lady doesn't forget anything. And also, I want to thank Shannon Weidman, who's the beautiful, wonderful psychiatrist that William has. Not only does he think she's beautiful, but he loves her as well as all of the other students, all of the other kids within the program. And without the without the drug court, I wouldn't have been able to make it this far. And I just want to say thank you. Thank you, Shannon. Thank you, Shannon. Thank you, Judge Greenberg.
Like my mom said, I would like to thank Shannon, Judge Greenberg, and Shauna, my therapist. Before drug court, I was failing out of school, skipping school a lot, doing marijuana. I had really bad grades. I was tending to lie a lot. And I would skip school so much that the principal he told me if I got caught doing anything else one more time that I was going to get expelled. Well, I thought I was invincible, so I continued to do all of the things that I was doing before that were keeping me in trouble. I got expelled from Martinsburg High School. I went to the alternative school in Pikeside. Well, not long after that, drug court didn't want me to go to school for 2 hours, and they wanted me to have a full day. So I went to Jefferson County. It's called OLC, you go all day, and that really helped me a lot, because without that, I would have probably failed 10th grade. I got my grades up second semester, and now I'm in 11th grade at Jefferson High School. Drug court has helped me change in many ways. My grades are really way better. I'm attending school much more. And I can finally say I'm doing the right thing for myself. And I'm looking at my future, and I'm seeing that I can finally be somebody. My thoughts on substance abuse are, it's not like you don't want, that's not the road that you want to go. Like he said, his son was doing bad things, and look at where he turned out. So I want to thank you guys for having me and my mom. I appreciate everything that the drug court, Judge Greenberg, Miss Shannon, and Shauna Weidman are doing for me. And thank you.
Well, I want to thank both of you for being here today. And William, keep up the good work. We're very proud of you. That's what we like to hear. In the second phase of Justice Reinvestment, West Virginia has also committed nearly $10 million to support community-based substance abuse services at existing facilities. And over the past 5 years, DHHR's Bureau for Behavioral Health and Health Facilities has provided nearly $29 million on an average of $5.8 million a year for substance abuse-related service and activities, and has awarded nearly $3 million to develop or expand drug treatment programs in counties all across West Virginia where services were formerly limited or non-existent. Today, I'm proud to have Paul Macomb, CEO of Eastridge Health Systems, with us to tell us a bit more about how these investments make a difference on the local level. So please join me in welcoming Paul to the podium. Paul?
Good morning. Thank you, Governor, for convening this summit in this area. I've been asked to speak briefly about the variety of substance abuse services that are available in our three-county panhandle. The fact is, unfortunately, that we do not have a wide array or an extensive array of programs and services available in our area. What we do have, however, is a substantial number of providers and potential providers. We do not have a detox unit, nor do we have any residential services within the three-county area. We do have a variety of outpatient services available from a variety of providers. These would include individual and group therapies, Suboxone programs, DUI programs, juvenile drug court in Berkeley and Jefferson, Day Report Center in Jefferson County, soon to be in Berkeley County. There are also needle exchange programs being initiated by the health departments. While I cannot speak to the volume of services provided by other organizations and private practitioners, I can briefly indicate the volume of services provided by Eastridge. During the preceding 12 months, we've provided the following in all three of our counties in the Panhandle. Substance abuse outpatient services to 383 individuals. Substance abuse outpatient medical services to 778 individuals. Substance abuse intensive outpatient services to 54 individuals. DUI classes and therapy to 278 individuals. Suboxone medication and therapy to 253 individuals. Juvenile drug court services to 8 children in Jefferson County. We are painfully aware, I think most of the people in this room are painfully aware that these services provided to that number of individuals, plus the services provided by other organizations and practitioners, does not begin to scratch the surface of the need. As a community, we do have a widespread interest in the substance abuse problem that exists in our area. The fact that this room is standing room only is proof of that. We have several individuals and groups who have expressed interest or have taken the very first steps to establish a variety of services. If there's a takeaway from my very brief talk this morning, I would like the following 2 points to be remembered. I believe that these groups and individuals share a common vision. That vision is of a continuum of services that would include but not be limited to inpatient detox, residential services, both professionally managed and peer-driven, and an expansion of the currently available outpatient services. In short, services beginning with the most structure and progressively moving to the least structure. This continuum needs to exist within our three-county area. If the vision is to become a reality, and this is the most important thing to me, if it is to become a reality, it is critically important that the concerned groups and individuals come together to cooperate and collaborate in the development of the needed services. Thank you very much for your time. Again, thank you, Governor.
Well, thank you very much, Paul, and for all that you and your team at Eastridge Health Systems do to support the residents of the Eastern Panhandle. We'll continue to improve access to these services across the state, but we can do that by working together and collaborating with providers and residents in our local communities. As Paul said, we can also create a continuum of care that supports a safe and healthy recovery for all. Now, it's important to have a variety of treatment options available, but sometimes what it really takes to get started on the road to recovery is a conversation with someone who understands your situation or has overcome similar struggles. At this time, it's my pleasure to welcome and introduce Kevin Knowles. Kevin is a member of the Martinsburg City Council and is also celebrating 18 years of recovery. He plays a very active role in this community and has dedicated a large part of his life to helping those who are struggling get back on their feet and get the help that they need. So, ladies and gentlemen, please join me in welcoming Kevin to the podium to share a few words. Kevin.
Thank you, Governor. Thank you for putting this all together. Thank you for everybody here, because we all have the same concern. We know what's going on here in our county, in our area. And I'm not here today as a city councilman. I'm not here as a business owner of downtown Martinsburg. And I'm not here as a trusted employee of a family-owned business. I'm here to tell you a story about my problems with addiction. I come from a very, very good and large Irish Catholic family. And in some cases, people would say that's enough. But I have to tell you that my family was very well respected, very well-to-do, very upper middle class. Never had to want or need for anything. My mother and father were great, loving and caring parents, and taught me about values and how to live life and to give back to your community. But I have to tell you that over the years, as I was growing up, alcohol was first in my life. And, back then, alcohol was accepted at a very young age. There was very little restriction. And I used it and abused it for a lot of years. And I got to tell you that through all this abuse of not just alcohol, but I also had, in the 80s, I had a cocaine problem that cost me an awful lot and cost my family an awful lot. I didn't get up one morning and have a cup of coffee and say, hey, I think I'll get in recovery. There was a long history of incidences in my life that continued to drag me down deeper with the addiction of cocaine and also deeper with the addiction of an abuse of alcohol. I was one of those kind of guys that I applaud William. At your age, when I was your age, I was a high school athlete, and it was one of those things where I had the world in my hand at the time. I could have done anything. I had every opportunity presented to me. My parents, they were very, very proud of me at the time, and I had opportunities to go wherever I wanted in college. I was highly touted for 2 different sports, and you know what? I have to say that because of addiction, because of my abuse of alcohol at the time, it took all those aspirations away. This is a taking disease, as I know it. It takes, and takes. It took every dream and every aspiration that I ever had, because I didn't want to be that person that I was at the time. It just happened to be that way. Things started to happen in my life, and I started to pay some consequences. And thank God that I had very good people in my life from the get-go and all through my life, that I never had to spend a day in jail. Because there was probably times that I did things in my life that I probably should have spent some time in jail. My life continued to go down that path. And I remember the first time that somebody offered me a drug. I was probably in my mid-20s. Swore I would never do a drug. Alcohol, you give me all the alcohol in the world, and that's okay because that's legal. But I remember doing that drug for the first time, and when I took it and I snorted it, the first thing out of my mouth was, where do I get more of this? And that's how fast it took me. And although it was a short period of time in my life, it really took an awful lot away from me in a short period of time. My family didn't know what to do with me, because now I was combining everything. I was combining the drugs with the alcohol. At the time, I was a very highly respected high school coach, baseball and wrestling coach. I was living 2 lives. I was living 2 lives, and people didn't know it. They just thought I was a little bit off in some cases, but the ones that were close to me, they knew it, and they knew it very, very well. At that time, someone approached me, and this was back in the 80s, and they said, hey, you know what, you need some help. And if you don't find help, certain things are going to happen. And I was very lucky because I have a younger brother that is in sobriety and in recovery for over 30 years. And at the time, he was in recovery, and they found me a place in my community. They found me a place in my community. I went into an in-treatment program. I didn't have a problem with the drugs once I got out, you know. I thought that was it. And I just kept relying on the alcohol. And as time went on, I just kept going down and down, deeper and deeper into that hole of alcoholism. See, I'll tell you that because alcohol is a drug too. It just happens to be legal. And for me, I abused it. I abused everything that I ever put into my body. You know, it came to a point where I had gotten a DUI in 1991, and in Pennsylvania, Lackawanna County. I was very fortunate for the drug courts and alcohol courts there at the time that they gave me what they called an ARD program, which was an auxiliary rehabilitation type deal that I needed to go through. And if I completed it and went through it through a period of time and came through on the other end, that they would take that off my record. And I did that. You know, I did that. And I didn't, for a long time, I didn't drink. And I had some things happen in my life. I had some losses happen, some personal losses. And my father, who happened to be my best friend at the time, he saw me in recovery the first year we celebrated. And it was the first time I saw my father cry. And I saw his chest pop out. It might have popped out before, how proud he was of me. And then the second year, the same thing happened, you know. Well, the third year came, and next thing I know, I had my father in my arms, and he was dying. And he had said to me, he wanted to talk to me before he left this world. And he said, I want you to do me something. Do me a favor, because I know no matter what, because he knew the kind of guy I was, because I've heard it so many times, I was one of those kind of guys that had a really big heart but a very dark soul. And that was the dark soul was what I was keeping the stuff inside of me that I was stuffing down and hiding with the drugs and the alcohol. And he said, you know that woman, your mother, first day I met her, I fell in love with her. What I want you to do is I want you to treat her and give her everything that she needs to continue the life that she's deserved. Those were the last words my dad said to me. And I got mad at everybody. I got mad at the world because I thought they took my best friend away. And you know what? I left recovery. I did not choose to use or drink or do anything. I just left recovery. And I left recovery for a while. And during a period of time, some of the consequences of my actions, I've been shot, I've been stabbed as a direct result of where I shouldn't have been in different places. I lost a daughter for 18 years. Beautiful daughter. I was not there emotionally, I was not there physically, I was just a paycheck I would pay once a month. And if you had asked me if I was a good father back then, I'd say I was Father of the Year. In reality, I was a terrible father. I wasn't there. I lost that. 1997, I had my last bout with addiction, active addiction. I had an incident happen to me after all these years of all the bad stuff that happened, you know, the businesses, the hurt, the pain that I caused my parents, the hurt and the pain that I caused my family. They knew that I was hurting deep down inside, but they knew there was only one way that was going to be fixed, and that would be that I needed to seek that help myself. And something happened to me. It happened to me on October 20th, 1997. And I had a little relapse. And it wasn't pretty. It wasn't pretty. I came to the next day, and the first thing out of my mouth is, I don't want to live like this anymore. I had to change me. I made a phone call that day. I called my younger brother, who at the time was 13 years in recovery. And he told me, he says, don't talk to anybody, don't do anything, lock the doors, I'll be right there. And he found me a place of recovery. And I went to this treatment facility. It's the second one that I was at, 86 and 97. But this time something was different. This time I wanted to change my life, and I didn't want to be that person that I had become. I remember being in that facility, and we heard today about hope. We heard about the 3 Ps the governor talks about all the time: private, public, partnerships. And a young girl came to me, and I was telling her about how I hadn't talked to my daughter, and I don't know how long, and that my daughter didn't want any part of me, and I didn't know what to do. And this young girl had a quarter. She goes, I'm going to take you to the phone, and we're going to call your daughter. Well, I'm a pretty big guy, and I was shaking like a leaf. And she said, you'll be okay. And I remember calling, something happened. This one, I believe, something really happened when hope stepped back into my life. And that hope was the people that were in that recovery at the time, the people that were in that treatment facility at the time, that were there to support me to do what I did. Didn't know what I was doing, but they told me what to do. And I remember picking up the phone, and I called my daughter. And at the time, she was 20 years old. And I remember saying to her, I said, Kara, I'm sorry for all the hurt and the pain that I've caused you. And I broke down crying. It was the first time in my life that I ever shed a tear. And I was crying like a baby, and my daughter did not hesitate. And she said, you know, Dad, there's times I needed you and you weren't there. There's times in my life I wish I never saw you again. You know, Dad, what you need to do is you need to reach down deep inside you. Find out what makes you do the things you do. You need to bring God back into your life. She said, you know, Dad, once you do that, the one thing I never denied was the love you have for me and the love I have for you. Well, it was like somebody threw me a life jacket that day, and I held on to that. That was my hope. That was my hope, that I was going to have that relationship that I always wanted, the relationship I always dreamed about. I got into recovery, and I'm in recovery. I'm not around it. I'm in recovery. And for 18 years, I've been seeing people die left and right. I moved here about 11 years ago, and I've had the opportunity, the unpleasant and some pleasant opportunities to do what we call interventions, quite a few of them. And I can't tell you how many times that I sat at a kitchen table or on a park bench and talked to someone who was struggling with addiction. And we had nowhere to go, nowhere to take them, no insurance, no nothing in West Virginia where we were at. And the sad part about it is most of them died right after that. So there's hope. There's hope here today. There's hope in this room. We've heard a lot of good things. Because there was hope for me when I was hopeless. And you know what? I am no one special. You know, I'm just someone that just happened to be in the right place at the right time, that I was willing to take this help from people. I've been able now, since I've been in recovery, to work in recovery communities in over 25 cities in the United States, 20 countries in the world. I've had that interaction with those recovery communities. I've seen what works. I've seen what doesn't work, you know. And I thank God every day that I am a proud man in recovery. Because if I'm not here to share with someone about what I went through and how I came through on the other end, there would be no help. There would be no hope, because there was people there for me. I've been able to get everything back in my life. I am now a proud member of a community, a very, very proud member of the city council of our wonderful city of Martinsburg. And that would not have happened had I not found recovery, if I had not stayed in recovery, if I had not been involved in recovery. Because you need to be involved. At least I need to be involved. And last night I had an opportunity to be with one of the local law enforcement, our new wonderful police chief that he's here on the job for a week. And there was a call yesterday that two two individuals were overdosing. They overdosed on one of our city streets up in one of the neighborhoods. And the problem is we were able to revive them, and they just left. Because West Virginia does not have a paraphernalia law for personal possession. This is where we need to get it. We need to be able to address that person right from the get-go. They could have all them paraphernalia on and nothing could be done. And in my job, I see it all the time. But I want to thank everybody here. I could go on and on with the stories of woe in my life. But the most important thing is, I have to tell you that I got up this morning, my heart was pounding. I was shaking. I talked to a couple people. I went to my friend of mine who happens to be my boss. We sat in his office. He told me to go for a walk. And I have to tell you that right now I'm as calm as could be. Because you know what? This is not about a political career. This is not about a job. This is not about me. This is about saving lives in Berkeley County. And that's why we're here. Governor, thank you.
Well, thank you, Kevin, for that, for your presentation. It's very touching, and I think Delegate Skinner mentioned that about the president coming to Charleston. Well, I got to say that both Kevin and Doug made that trip to Charleston, and I saw them there at the president's meeting on substance abuse. So, they're dedicated to what they're saying here today, and I appreciate both of you. So I've said time and time again, substance abuse affects so many West Virginians, and unfortunately, far too many of our state's children live in homes affected by this epidemic. In March, I was proud to join U.S. Attorney Booth Goodwin and representatives from the State Police, DHHR, and the Department of Education to launch the Handle with Care program. Now, I'm not sure how many of you have heard about it, but it's an initiative designed to put our kids' safety and well-being first. Handle with Care offers a holistic approach that considers not only the physical safety, but also the mental health of children who have been removed from an unsafe environment. In the case of an emergency situation, it connects law enforcement officers at the scene with the child's school to make sure that all principals and teachers know to treat that child with a little extra special care. Handle with Care is now up and running in the Eastern Panhandle, and I'm pleased to have Gary McDaniel with us to speak more about this program. Now, Gary is a social worker with Morgan County Schools and actively supports children in need of this program. Gary?
I'm here today to talk to you about Handle with Care, which is a program that we recently implemented in Morgan County Schools. But I can't talk to you about it alone. I have to get Chief Deputy Wade Shambaugh to come join me. The reason why give him a hand. The reason why it's important that we both speak to you is because this is a collaborative program. Booth Goodwin, Andrea Darr, Lieutenant Chad Napier came to Morgan County this summer. Wade and I were both in that meeting, and when we were done hearing their presentation about the program that they piloted in Charleston, we looked at each other and we said, let's do it, right? So, and it takes both school and law enforcement to make this program work. There are really three components of Handle with Care. The first is just when law enforcement goes into a home and there are children in that home, they might be there to serve a warrant for substance abuse. They might be there for some other reason, domestic violence, perhaps. I think Wade was talking to me on the way up here about one time they had to remove a body from a home and there are children sitting there on the couch. So whenever there's a traumatic event that happens like that, very often it is substance abuse. The police department and our deputy, Vince Shambaugh, has collaborated with our state police and our local police. So it's not just the sheriff's department, it's any law enforcement in Morgan County. When they encounter children in a home that they have entered for whatever reason, they send a notice to our school system. It's actually Deputy Kevin Barney right over there. Wave your hand. Yeah, give him a hand too. These guys are amazing. They do a great job. And if you'll notice, Morgan County, like if you see all the dots on all the little places of the state here, this is Morgan County right here. This is the county with no dots, right? So really what it requires for us to meet the needs of kids is collaboration. And we have a very high degree of collaboration in Morgan County. So very simply, Officer Barney gets a report from any branch of law enforcement in Morgan County. He sends that to the school system, sends it to me, sends it to the principal. The principal then passes it on to the teacher, the bus driver, anyone who's going to be working with that child today. There's no breach of confidentiality. It just simply says handle with care. It has the child's name on it. And then we know as a staff that we need to be a little bit gentler with that kid today. There's probably a really good reason why he doesn't have his homework done or she's not ready to take a test if there was a warrant enforced in their house the night before. There are two other components to handle with care. It is not just a notification, but also the second and third phases of this that we're working on now are to expand trauma-informed care within our school system so that we have a lot of people trained on what you do, how you receive, how you work with a child who has been traumatized in this way. And then the third part is to have mental health providers available to come work with those children in the school setting if necessary. Not every child, not every family can get to Eastridge or one of our mental health centers because of transportation issues, because their parents are incarcerated, because they're living with their cousins or uncles or whatnot, for all kinds of reasons. So those are the three components. Eastridge, of course, does have a presence in our community. There should be probably at least one dot on that little county there. And Eastridge is working with us to help provide that care. We have a wonderful prevention partnership in our community, the Morgan County Prevention Partnership, and we do have an SBIRT grant through them. So we are doing some screening, brief intervention, and referral to treatment in our school system as well. But I wanted to just turn this over to Chief Deputy Shambaugh for a minute so he can talk more about the human impact of this. He's the guy that actually goes into the houses and enforces warrants and makes arrests where children are present. He's also a father. Most of our guys in Morgan County are, and that of course, changes the way you perceive children when you have your own. At least that did for me. Anyway, Chief Deputy Shambaugh, if you'd say a few words.
Not a whole lot I can add to that other than a little bit from a law enforcement perspective. In law enforcement, we get approached to participate in a lot of programs. A lot of stuff's hard to implement or expensive, not really that beneficial. Sometimes, quite frankly, it's just to make the public feel good, doesn't really benefit anybody. Handle with Care program is not one of those. It was very simple to implement, very important, almost no expense. In Morgan County, we basically implemented it with a couple of phone calls. The State Police Detachment Commander was like, yeah, I'll send an email, make it mandatory for my guys to do it. The two police chiefs were, yeah, we'll do it. We did it within the department. I personally have been in houses at 2 or 3 o'clock in the morning where there's a knockdown, drag out domestic, or we have a warrant to serve on somebody. We're dragging a family member out of the house. Or in the worst case scenario, not that long ago, we're removing a dead body from the house. And there's kids of elementary school age in the house. That kid should not have to take a test the next day. If a kid's upset the next day, the people in school should be aware of why. If that kid needs a nap the next day. Unfortunately, the only positive adult interaction some of these kids get is at school. And the handle with care is just that simple. Any of our guys that have something going on in a house where there are school-age children, they text a couple people. Those people get the information to the school officials that need it. It's really just that simple. It's not too many programs are that easy, that simple, and work that well. And it's one reason, it's a big reason that it wasn't hard to get us on board and get it going. Thank you.
The last thing I'll say is that they are willing to help support any county that wants to get Handle with Care started. Booth Goodwin, Chad Napier, Andrea Darr all came. They trained all of our staff our first day of school. They didn't charge us for that. They just came and did that training for us, and we were able to implement it the first day of school. Within the first week of school, we had our first Handle with Care report, and we've had several since then, and have had the opportunity to help those kids adjust to their school day the following day. That's all I'll say. Thank you very much for your time. Thank you, Governor. Thank you, Sheriff LeMasters, too.
Thank you, Gary, for being here today and for your commitment to the Handle with Care program. As he said, you don't have to actually be hooked on drugs but to be exposed to it. And across the state of West Virginia, it is so sad, the number of our students who are affected because of their parents or the activity going on in their home that most of us don't know about. And I think that the Handle with Care program is a great program because if the law enforcement knows and can inform the school system of what that child's going through, that's the kind of support they need when they go to school. So thanks to all of you guys who are involved with that. Throughout the school year, I've worked hard to stress to our students that daily attendance is critical to their success, but I've also come to realize that students can be truant for various reasons. And some miss school for long-term illnesses, some because they're being bullied by their peers, and still others because of difficult family situations, as I was just saying, that are unknown to most. But anyhow, to help address this problem, we've also started another program. We've launched a statewide truancy diversion initiative as part of my comprehensive juvenile justice reform, which was passed earlier this year by the legislature. Now, this initiative helps county school systems provide early intervention services to kids who need them most, keeping them in school and providing them with the individualized attention they need to get back on track. In addition to protecting students who are stuck in the middle of a family member struggle with substance abuse, we must also work to provide education about the negative impacts that substance abuse can have on their lives and on their futures. And today we're joined by Deputy Kevin Barney, who is we've already had you up here. Sorry, I got off. Do you have another one? Okay, but anyhow, got me off script here just a little bit, ladies and gentlemen. But anyhow, he's the Prevention and Resource Officer at Berkeley Springs High School. So in addition to ensuring the safety of our students at school, Deputy Barney works with students to provide substance abuse prevention education. So please join me in welcoming Deputy Barney.
Good morning, and thank you, Governor Tomblin, for letting me be here today to represent the Prevention Resource Officers, my department, Morgan County. I didn't know they were going to send my bosses to check on me, but they're both here. Actually, I don't see my bosses very much because I'm in the schools 35 hours a week when they're in session. So when you don't have your kids, we have them. They're with us all day long. They go home and have dinner, and then we get them back the next day. You talked about the truancy diversion. I also work with the attendance director, so when children are out for several days, we go do home checks, make sure they're okay. We do several things with all of our children. The one thing that the PRO program does is that we don't tell them not to do drugs, we tell them the disadvantages of them. We tell them how it's going to affect their futures. Currently, right now in West Virginia, we have 78 PROs. They're in 78 of your schools and in 35 of your counties. Those officers are trained yearly and certified by the state to be in those schools. We facilitate classes. We are not teachers. We work with the teachers, though. I personally have a program that I teach 2 classes I just said it. I facilitate 2 classes a day. And I work with a family and consumer education teacher. We teach the kids how to cook on their own. We teach them the dangers of being on drugs. We teach them how to drive. We teach them the basics of getting through life so when they walk out of our doors at the high school, that they can survive on their own. Some of the programs that I'm also what they call a liaison. I monitor 11 other PROs in my area, and we offer assistance to them. We give them classes that they can facilitate in their own areas, and some of those we do non-traditional topics. One of them is the drugs, and we will do classes about impaired driving. We call it impaired driving. Somebody mentioned drug driving. We call it impaired. Anything that alters their way of being able to drive a car properly. So we work with our driver's ed program. With the drugs, we also, for good or bad, the kids come to me and tell me what's going on. They tell me where in the community to go look. It's sad that they know that, but I'm glad they come tell me. The purpose of the PRO program, one of the main purposes, is to bring law enforcement and education together. How many of you have ever talked to a police officer who wasn't there to break up a fight? Who wasn't there to arrest somebody, who you weren't mad at after they left? So now these kids are getting positive interaction with law enforcement so they can come to us. I've been called out of bed in the morning because one of my students gets in trouble, and they say, I will only talk to him. So we go out and deal with them, and we take care of it, and we address problems that they might be having at that given time. They're not things that we can't fix. We just need to address them. Some of the things we do with the drugs and alcohol, and we do, I think the gentleman there mentioned that alcohol is a drug also. We do talk about tobacco, we talk about the alcohol, and we talk about drugs itself. We let them know the dangers. We do things like we use what they call drunk goggles. We actually put them on the kids so they get to feel what it's going to feel like. It's not exactly, obviously, but it's close. And then we put them in a golf cart and let them drive around the parking lot. And we have pictures of cardboard people sitting there, and when they hit them, they feel really bad. And this is what I'd rather them hit the cardboard than a real person. So we work with the kids. They call for help, and after you do a class, you might get a student that comes up and tells you, hey, I've got a problem. And if they ask for help, we're going to find them some. And if they might tell you about a family member. They might tell you about a friend. It doesn't matter as long as they come to us. So we're just trying to make sure that all law enforcement is portrayed in that views, that we're not there to put them all in jail. Everybody said that there are some that need to be there, but there are some that just need put back on the right track, and that's what we're trying to do. So Berkeley County has them. Sheriff LeMaster has several officers in his schools. We have one in our school, and I cover all 7 of our schools. So if you see one and you have information, ask for some help. If you're having a problem with your child, find an officer that's in your school. And if you can't find one, find a nearby one. We'll come help. Thank you for your time.
Well, thank you, Deputy, for the work that you and your fellow officers across the state are doing in our local schools. And please tell your students to keep up the good work. Outside the classroom, we're also working to raise awareness about substance abuse and spread the message that if you or somebody you know is struggling, there is hope and there is help for you in West Virginia. This past September, we took a major step forward in our fight against substance abuse and launched the state's first ever, hi Tiffany, just noticed you back there, first ever substance abuse call line. It's here at the bottom, 844-HELP-4WV. Now, this new 24-hour call line provides referral support for those seeking recovery services. As many of us know, those struggling with addiction are often reluctant to take the first step and seek help. But now West Virginians all across the state have the opportunity to just talk with a professionally certified call line agent, discuss available treatment options, choose a path, and begin the road to recovery. So far, 844-HELP-4WV has talked to more than 350 people in the last 45 to 60 days to connect them with the resources and treatment they need to get help and return to their families, communities, and workplaces. And I'm proud to have Andrea St. Clair, she's the program director at First Choice Health Systems, with us to talk to you about how the call line works and what it means to the people of West Virginia who are struggling. Andrea? Good to see you.
Good afternoon. As the governor said, I'm Andrea St. Clair. I am also a clinical supervisor for the Helpline. And I want to thank everybody for sharing their stories today and for their courage and just showing how addiction has impacted individuals' lives throughout West Virginia. So I'm going to speak a little bit about our Helpline and just kind of let you know about how the flow of the Helpline goes when someone calls us. We do have a staffed person there 24 hours, so when someone calls, they don't get an automated message. They do speak with an individual. The 1-844-HELP-4-WV is also a textable number. People can text us if they don't feel comfortable calling the Helpline. They can also go to help4wv.com and chat with a peer support specialist or call agent as well. The calls are coming from individuals who are struggling with addictions. Specifically, we've mostly been getting calls for narcotic addictions. Their loved ones are also calling us as well. I think for every family member that calls, there are 2 individuals calling us as well that are seeking treatment. So we will get community providers that call us as well, looking for resources to help link people with that are in their community. If they're being discharged from an inpatient facility, they'll call us to help kind of arrange treatment for that person as a follow-up, because that is essential to recovery, is to have that continuum of care throughout their recovery process. We also do mental health as well. We've been getting some calls for depression and anxiety. It's usually co-occurring, though. Most people are calling for detox from substances. And we're also, when people do call us, the first thing we ask them is, how can we help you? We don't ask what insurance you have or anything like that. We ask how we can help you, what's going on with you. We like to build that rapport with the people that call so that they can feel comfortable sharing their story with a complete stranger. We also like to know about the different resources in the communities just so we can have a better access and navigation throughout the system. That's the main reason we feel this helpline is so important, because a lot of people they're not even aware of like the resources in their area or how to access those resources. So navigation and access to resources has been essential in helping people overcome barriers to receiving treatment. And that's one of the main points we'd like to get across, is just that access to care. That's what we are hoping to do. We do a warm line referral as well. People can call in, and if they're looking for like an appointment or an inpatient facility that they want to go to, we can call that facility with the individual on the phone and just kind of give them a little bit of their story so they don't have to repeat it, and they can feel more comfortable when we actually hand them over to that person. So it is like a warm handoff, so they don't maybe feel so anxious about trying to get into treatment somewhere. After we do help link people with resources, we like to follow up with them if they allow us to. We follow up at 48 hours, we follow up at 1 week, 1 month, and then 3 months, just to make sure that they have gotten the treatment that they wanted and that was successful to their particular situation. And then during that follow-up, too, we can also identify any barriers they've had, and we are keeping track of that just so we can kind of see where there have been struggles with people getting into treatment. And if someone calls in a crisis-type situation, we will follow up with them in 24 hours instead of the 48 hours just to ensure that they are safe and they've gotten the treatment that they needed. And then the resources that we have are also available on our website. If anybody is with an agency and they go on there and they see any resources that they feel need updated or anything that you would like us to add, you can contact us directly. You all can call the 1-844-HELP-4-WV as well and let us know if there's anything that needs added, because that is essential to what we're doing as well, because we do want to provide people with hope that they can receive treatment and get back on their feet and get back in the community and do the things that they hope to do. So that's really the basic rundown of our helpline. We will be available after this if you all have any questions or would like to get our contact information or anything like that. And we do have a peer support specialist here today that is going to share a little bit about what she does when she gets a call. And we have a great staff. They're very caring. They are very passionate about the cause, and they really want to help the people of West Virginia get back on their feet and fight the addiction issues that we're having. So thank you for your time, and I really appreciate the opportunity to be here. Thank you.
Folks, I know we're running just a little bit long, but we'll be through shortly here. But first, Andrea, thank you for all that you and your team at First Choice do to help save lives in West Virginia. This time, I'm exceptionally pleased to introduce Jamie Moffitt. Born and raised in West Virginia, Jamie started battling drug and alcohol abuse at a very early age. Determined to take her life back, she sought help at a long-term treatment facility for women and stands before us today, 2 years and 9 months sober. Now, as a call-line employee with First Choice, she's helping others who are struggling to find the help they need to begin the road to recovery. I met Jamie at the call-line launch in September and was truly inspired by her story. Ladies and gentlemen, please join me in welcoming Jamie. Jamie.
Good morning, everybody. Thank you, Governor. It's an honor to be invited here today to share a little bit about my story and why I do what I do. Part of what we're trying to do here, and the reason that I'm here, is because peer support is so crucial to recovery. A lot of people, they feel misunderstood, they feel alone, they feel this impending doom, but when they see someone that has been through what they've been through, that has done the things that they have done in active addiction, that has pulled out of it, it gives a lot of hope. And that's one of the main words that I heard here today was hope. Hope can go a long way. Hope can turn into faith and courage. And I was told that the acronym for hope was Hold On, Pain Ends. And that's kind of rang true to me. And the other word that kind of stuck out to me today was collaborative. This is a group effort. There is not one program, there is not one facility, one organization that can fight this thing by themselves. We have to do this together as a group and as a team, which is why some of what we're doing on the phone line is we're also doing a lot of community outreach. We are going to, my program director and I, we're going to the different homeless shelters, the drop-in centers, the drug courts and day reports. We're trying to communicate with them. We have some library events that we're trying to facilitate to meet these people where they are. Some people, they can't get on TV and see advertising, or they don't listen to the radio or any of that. Or, they're in a homeless shelter, they're here or there, or their mind is just so fogged that they can't focus long enough. So we're going where they are. To kind of meet them and to reach out, because either maybe they don't have the courage, maybe they haven't heard about the program. There's multiple reasons, and we really want to get this out there, and we really want to spread the word, because we can help all of the facilities in here. They can call us, and then we get them hooked up with all the different facilities. So I think it's just really important that we all work together to do this. I do encourage anyone who is in recovery to kind of step out of your comfort zone and reach out and try to help people, because I know for me, if there hadn't been people there that have been through what I've been through, I don't think that I would have taken what they said as seriously. I don't know. I really appreciate being here, and that's about all I got. Thank you.
And Jamie, thank you for sharing your inspiring story and for being a role model for others who are having similar problems like you did, and for dedicating your life to helping West Virginians. It's my hope that your story and the stories from so many that we have heard today will serve as a constant reminder to every West Virginian struggling with substance abuse that you can find help and hope in West Virginia. Over the past several years, we have come a long way in this fight against substance abuse, but there's still a lot more work to be done, and that's why it's so important that we continue to work together as state and federal leaders, as community members, county and local officials, medical professionals, service providers, teachers, law enforcement officers, and family members to find ways to provide those who need the help they need to support to get back on their feet again, return to their families, their communities, and their workplaces, and lead happy, healthy lives here in West Virginia. So thank you all for coming today. And remember, if your family member, your friends, your neighbors have a substance abuse problem here in West Virginia, there is hope and there's help for you in the state of West Virginia. Thank you all for coming today.